Um, I'm Professor Owen Epstein. I'm the Professor of Gastroenterology at the Royal Free Hospital, and I'm the Director of the Institute for Minimally Invasive Gastroenterology. The body has got really two components to it. There's what I would like to think of as the hardware, which are the organ systems, so the heart, the lungs, the liver, kidney, spleen, bowel, etc. But then there's also software. Most of Western medicine is focused around the hardware. So we think in terms of the organ systems, and we have lots of ways of investigating with CT, MRI, endoscopy, blood tests, etc. However, it's become obvious over the past few years that many people presenting with illnesses where there's no abnormality shown on the usual investigations, the problem almost certainly lies in the software. And the software relates to the system that integrates all our organ systems. It's the conductor of our organ systems. And central to that is the vagus nerve. So let me address the question, what is the vagus nerve? And I'm just going to share my screen with you. I'd like to think of it as being the internet of the body. And to explain that a little further, I'm going to show you this diagram, which illustrates the brain. It's a view of the brain from below. And what you'll notice is that there are 12 nerves that come out of the bottom of the brain. They call the cranial nerves. You can see number one cranial nerve is called the olfactory nerve, the one that allows us to smell. And then there is 2, 3, 4, and you'll see that all of these nerves actually feed the face, the mouth, the throat, and the ear. However, if you look at this nerve over here, which is number 10, which is the vagus nerve, you'll see that in this diagram, the vagus nerve actually sends branches out to the whole body. So it's a very special nerve. Cranial nerves subserve the face. The vagus nerve subserves all the organs. And if I were to show you a picture of the vagus nerve in its entirety, rather than being a short nerve going to the face and the mouth, you'll notice over here that the vagus nerve is traveling throughout the body. And if I show you the next slide, you'll see that in actual fact, the vagus nerve touches on all the organs. So it touches on the heart, the lungs, the stomach and the gastrointestinal tract, the kidneys, the spleen, etc. So this is the crucial thing about the vagus nerve. It's a very special nerve. It's the only cranial nerve which leaves the head and neck, and it subserves all these other organ systems. I think that the next question is, why is this nerve so different from all other cranial nerves? Why did nature put that in place? And it's become quite evident that this nerve acts as the ears, eyes, nose, and mouth, I suppose, of the inner organs. So while our outer senses are giving us information about the outside world, the vagus nerve is telling the brain about our inside world. And again, if I show this to you, I'll share my screen again. You'll see over here in this diagram that this represents the organs of the body that the vagus nerve touches on. And you'll see that the arrows point in two directions. So for example, if you look at the heart over here, there are messages that the vagus nerve carries from the heart to the brain, and the brain can interpret that and send messages back to the heart. So for example, if you're climbing upstairs, the message will come that you need to have more oxygen to your muscles. The brain will then start to suggest to your heart that it should beat a little faster, and the control mechanism for the heart is really within the vagus nerve internet branch. And you'll see likewise the ear, the lungs, the pancreas, liver, kidney, spleen, and the gastrointestinal tract in particular. There is this two-way interaction between what's coming upstream, like uploading from the internet, and downstream, which is downloading through the internet. So if you think of the vagus nerve as the internet of the body, carrying messages up and down, informing the brain of our sense of well-being, then I think you've understood what the vagus nerve is all about. So if you think of it, your external sense organs are very important in giving you information about the environment in which you're living. So that if your ear nerve isn't working properly, you'll be deaf. And if your nose nerve isn't working, like in coronavirus, for example, you won't be able to smell properly. So it's now becoming evident that if this very complex internet of the body is malfunctioning in some way, it's sending the wrong messages up to the brain. The brain doesn't know that it's the wrong message, fake news, if you want to think of it that way, and it will send out appropriate instructions to the body based on the information that it receives. So it's quite possible that that information carried from the body to the brain is not exactly correct. It's not attuned correctly. It's like being short-sighted and having to have glasses put on. So if the vagus nerve is conducting information that isn't exactly correct, the brain interpretation will take that message as it comes. So consequently, you can imagine a situation where, because of the vagus not functioning properly, people start to feel unwell, not necessarily because the organ that it's subserving is abnormal, but rather that the information system is where the problem lies. So there are a number of disorders that one can immediately think of where it may be that the information system is where the problem is, or the software is the problem rather than the hardware. An example of that might be irritable bowel syndrome. I'm a gastroenterologist, and many of the patients we see complain of bloating, change of bowel habit, excessive gas, distension. And we investigate them and we find that everything looks pretty normal. The x-rays, ultrasound, endoscopy, blood tests are all normal. However, if one starts to interrogate the internet of the body, or the vagus nerve, in a number of patients, you'll find that the conductor is not conducting the orchestra appropriately. And perhaps the problem lies in the vagus nerve rather than in the organ system. And the same would be true for other disorders such as headache, migraine, the condition known as fibromyalgia, people who experience palpitations without there being any problem with the heart, non-cardiac chest pain. There are numerous conditions which are very common where we can't really identify the abnormality by doing the usual tests that are available. So the vagus nerve looks to be a very important part of the software that we need to interrogate to try and understand some of these disorders, which are often put down to anxiety or nervousness. So it would be very helpful to have some method for investigating the vagus nerve and its function. Now, clearly, it's very difficult to actually measure the nerve directly. You can't really put a little probe or a needle into the nerve and see how it's functioning. However, over the past few years, a very clever method has been devised to investigate the conductor of the orchestra, which is the vagus nerve. And if I could explain this to you briefly, the vagus nerve, amongst many of its functions, is responsible for controlling heartbeat. So when you breathe in, if you take a breath in, what happens is that your brain gets a message via the vagus nerve that there is a lot of oxygen now in your lung. So the heart will speed up a little bit to get that oxygen distributed to the body. It'll speed up by a very tiny amount. It's microseconds. When you breathe out, a message goes to the brain via the vagus nerve to say that there's very little oxygen and therefore slow down. There's no real point in beating at a fast rate, slow down. Now, this variation between breathing in and breathing out is called heart rate variability. It's just really saying that heart rate varies with breathing, and you can measure that. And I've got over here the little device which we use to measure this. It's a wearable device. It's very lightweight, And in fact, what it is, it's a small computer which attaches to an electrode. This thing over here, it's like an ECG, a one-lead ECG. And it's worn under the clothes for 72 hours. So except when the patient showers or baths, this is kept on continuously. And for 72 hours, this little mini microcomputer is monitoring the change in heart rate. And we know what's normal and what's abnormal. So I'm going to share my screen with you now and show you what a normal recording looks like and what an abnormal recording looks like. So if you look at this colorful representation over here, what's shown along this long axis at the bottom over here is a 24-hour period. So that's from morning till morning. You'll see over here there's the picture of a moon, and that indicates that the patient has indicated that they have got into bed, that they're lying down in bed. And what you'll note is that throughout the day, the body sends out a signal which is represented, excuse me, during the day, the body sends out a message which is represented by this red color. And what this means is that the sympathetic nervous system, the nervous system that keeps us alert and awake and doing things, is dominant. During the day, we are really running on turbocharged fuel. However, as soon as we lie down at night, our body gets a message that it's time to rest, that the body is safe. We don't have to be aware of the external goings on. We're not working. Our brain isn't active in the normal wave. And so the body switches to what's called parasympathetic dominance. This is where the vagus nerve asserts its dominance over the sympathetic nervous system. So if you've got an orchestra which is being conducted by the vagus nerve, you have one part of the orchestra playing during the day, but as soon as the vagus nerve or the conductor sees that the music needs to change because of change of posture, the vagus nerve kicks in. Now, this next slide I'll show you over here indicates somebody who has abnormal function, and you don't have to be trained really to see the difference between the two. This again is a 24-hour study over here. And you'll notice that this is where the individual indicates they're going to bed rather late at night, 2 a.m. in the morning. But you'll see that rather than having half and half, most of the 24 hours is dominated by sympathetic activity, the body being active. So even though the patient was asleep during this period over here, the body was alert. It was as if the body's function was occurring during the day, even though the patient's lying in bed and should really have switched to what we call rest and restore. So if you think of it on the left-hand side, this is using fuel, and this is filling up your fuel tank. Whereas if the orchestration is abnormal, you can spend 24 hours, most of the day running out and eventually running on reserve. So this is really the basis for investigating the vagus nerve. It's called a 72-hour heart rate variability assessment, which gives us a window as to what's going on in terms of the software, and in particular, the conductor of the body's orchestra. Clearly, if a patient consults their primary care physician or a specialist, the first thing to do is to exclude hardware disorders by using the usual tests that we all know about. If that turns out to be unhelpful, there is the option to have a 72-hour heart rate variability assessment to look at the software. Now, clearly, if the software is abnormal, the big question really is, well, what do you do about that? The first observation that I've had in using this technology over the past few years is that part of the treatment is to be able to demonstrate to the patient that there's something wrong, that, you know, it's not psychological and stress and the stress of life, etc. Obviously, that plays a role. But by showing them in red and green rather than in black and white, that you can demonstrate an abnormality of the vagus nerve function, much the same as you could demonstrate something abnormal on a CT scan or an MRI scan, all of a sudden the patients feel safer. They feel that somebody is firstly interested in what the problem might be. they're taken into a new dimension, and they very quickly start to feel more empowered about their condition. Is there any way that we could improve vagus nerve function other than reassuring the patient that we found a cause, and therefore we can start to make inroads into understanding why they feel unwell? Well, there are some ways that this can be done. There are some individual things that can be undertaken, and there are some therapeutic interventions which can be helpful. So, for example, people with abnormal vagus function can be taught relaxation techniques, yoga, meditation, cold showers, as it happens, a very strong stimulus for the vagus nerve. And there are lots of personal interventions that one can take to try and stimulate the vagus nerve. But this is really quite difficult in terms of, living your daily life. And particularly if you're one of those individuals who find it quite difficult to meditate or to go off to a yoga class, etc. And what's become really rather interesting is the concept of vagus nerve stimulation. Now, as I showed you in one of the diagrams, the vagus nerve travels from the brain to the body and back, and obviously goes through the neck. So there's a big trunk of the vagus nerve in the neck. And it's possible to apply a very special kind of electrical stimulation to the vagus nerve in the neck. Now, I've got the device over here. This is the Rolls-Royce device. It's called Gamma Core Sapphire. It was developed to treat migraine, as it happens. But essentially, this device, if placed over the neck and in a particular position over the vagus nerve and switched on, it can provide a very special low-level electrical current with the idea of rebooting the vagus nerve, stimulating the vagus nerve. So the vagus nerve is the nerve of well-being. It's what makes us feel restful, allows us to digest our food, allows us to interact with other human beings, allows us to be creative, as opposed to the sympathetic nervous system, which is kind of driving us through the day. So by stimulating the vagus nerve, we do have access. The other access that's a possibility is through the ear, because this little bit of the ear over here, the little wobbly bit, the little wobbly bit on the front of the ear has got a branch of the vagus nerve. There is another way of getting at the vagus nerve through the skin, and that is to apply an electrical stimulation to a branch of the vagus nerve in the ear over here. Now, it's a small branch. It's an evolutionary branch. It's kind of what remains from the time when we had big ears. But there are devices which allow you to clip a little electrical stimulator to the earbud over here and to allow that to stimulate the vagus nerve. I think that the most effective method is to get the vagus nerve coming from the organ systems all the way to the brain. And therefore, this device over here, which is used usually for 2 to 6 minutes twice daily for usually 8 to 12 weeks to see whether there's a response or not, is perhaps one way that we can provide patients with access to therapy. So in summary, the vagus nerve is a very important part of our sense of well-being. It's not really part of the medical world in which we clinicians live, nor you as a patient perhaps live in, because so much of our work is focused around hardware. However, the vagus nerve is becoming a very important part of understanding those individuals, and they're the majority, who don't necessarily have hardware problems but feel unwell. The other very interesting developmental area in vagus nerve stimulation is that the vagus nerve is very important in controlling the immune system. And it tends to regulate the immune system so that it's in balance. And I just want to leave you with the following interesting observation. Through the COVID period, it was noted that in a few small trials, that patients who were admitted with breathing difficulties to hospital and perhaps moving the direction of requiring ventilation, that if they received vagus nerve stimulation as soon as they came into hospital, fewer of them deteriorated. And that's thought to be because part of the problem of coronavirus and people who get very ill is that the immune system is overactive. It's pushing out too many body chemicals. And in fact, by trying to counteract the virus, it's creating a sense of ill health. And there is a sense that that vagus nerve stimulation may be useful. Now, that hasn't been proven yet. Obviously, the whole focus has been on vaccination, and correctly so. But there are now some publications emerging to indicate that the vagus nerve can be used in immune situations, for example, inflammatory bowel disease, perhaps patients with other autoimmune diseases like rheumatoid arthritis, there may be a role for it. And the other interesting observation that's come out recently is that patients with long COVID, a number of those patients have got an abnormality of the vagus nerve, if you look at heart rate variability, and that their fatigue, tiredness is probably because the vagus nerve isn't restoring them to normality. And therefore, there may be a role for stimulating the vagus nerve in these individuals. Now, I'm not suggesting to you that the final word has been cast and that everybody should be rushing off to get vagus nerve stimulation. But I really use that as an example of indicating how important it is for clinicians, clinical medicine, and for patients to understand that being unwell isn't all about hardware, but it's about the bit we can't see, which is the software, and both need to be integrated into clinical care. And I think it's that message that I think I'd like to leave you with. Thank you.